can do it without any problem, like how the venous system is working. I'm concentrating today with the arterial system, okay, how the arterial system comes up. Before I start, I want you to pay attention to the word aortic arch. It's not arch of the aorta. Remember this is international problem. It's aortic arch. Some people or some books also write aortic sac to avoid this problem. But aortic arch is equally good. Aortic arch, there are many aortic arches. There are 6 aortic arches. It comes like this way. There are 6 of them. 6 of them this side and this side, 6 of them. And I'm going to tell you a story, slowly but surely you'll understand everything. Again, I really request all of you to pay attention to me, okay? That's what exactly I'm trying to do. It is very simple, but it needs a lot of attention. And I can assure you that there will be many questions coming up based on what I'm going to talk to you. Because there are many abnormalities like patent ductus arteriosus, coarctation of the aorta, and many of these, the double aortic arch, all these things can be, is possible because of the understanding of the embryology, okay? So please pay attention. If there is any problem, we can discuss. You can raise your hand a little bit towards the end, not at the outset, okay? Just so that I can finish it. I may go beyond 1 hour, and what is that? Did you call the female side? That I'll be maybe 10 minutes late. Okay. Let's start it. Are you ready? First of all, try to understand that how do we look like. I put it on myself, okay, not you. You are good-looking fellows, okay? So don't take it very personally, but I know for sure that how I look like. Not in the mirror, but if I put my hand over here, then I know that it is a little bit elevation. Then this is my ear. I don't know whether you have seen your ear yet, but this is my ear, and it goes inside, and then comes out. And then again over here, it goes inside and comes out. So if I draw that, you'll see that what I'm doing is, I'm doing like this. This is my ear, it comes out. This is my neck. On the inside of that, we look exactly like this. On the other side, we have the similar thing. We have this, then this is the ear, and inside also we have this. You understand that how I look like? If you don't believe me, this is your, okay? So it's a little awkward looking, but trust me, at least I look like this way. I don't know about you, but so this is the ear. Now, what I'm drawing over here, you have heard the name called pharyngeal arch. Yes. So you never knew that, what is this all about? We never explained to you. The reason is because it will be explained next year, when you are year 2, is the head and neck, because all the pharyngeal arch, when it is elevated, we call arch. Got it? When it is depression, we call pouch. So arch is like this, arch and pouch, arch and pouch, arch and pouch. There are 6 of them. And that's why our neck is formed over here, because of the pouch. How we look like, you understand how we look like? This is our neck. This is the neck. The neck, normally, it doesn't happen unless there is an up and down. So this is up, then down. Again up, and then down. So there are 6 of them. Of course, 6 of them, they do not survive. Many of them disappear, because I'll talk to that later and maybe in the year 2. But that's not so important what I'm trying to emphasize. What is important over here, that each arch will receive 1 artery. And it will be responsible for formation of some muscles over here, the bone over here, and the nerve. But due to 1 artery. There are 6. Remember the fact that this area, head and neck area, do not forget, head and neck area is formed because of the arch and the pouch. We call pharyngeal, because the pharynx is very close. That's what the name is, pharyngeal, arch and the pouch. Will you remember that? Arch is up, pouch is down. So we call this one is the first pharyngeal arch, we call first pharyngeal pouch. Okay, outside. And inside also we have the pouch. This is a special name over there, special name over there. We'll talk about that later. Many things are formed from the pharyngeal arch and the pouch. But what is important today is to appreciate the fact why there are 6 arteries coming out from the aortic arch. Because there are 6 pharyngeal arches. Each one should get 1. This is the concept that you have to ask. Why not 7? Why not 5? Why not 4? So the answer is because of the pharyngeal arches. We have 6 arches, 6 pouches. Each one should have 1 artery, 1 artery. Therefore, we have 6 arches. Is that clear to you? Yes?
Some arches would disappear.
Huh?
How say that?
Some of I'm coming to that. So which one disappear? I'll draw it. But first understand why there are 6 arteries will come out from the aortic arch. Now the second concept is that clear, everybody? Yes. There are 6. Okay, so I take it out. I don't want to keep this how I look like. Yeah, 6. This 6 sides. But how to get it out now? Oh, this is now. Can somebody help me to take it out? We need that. This will sometimes work, No,
لا عوادي دول يستخدموا
Okay.
عوادي
Now.
منديل ومعقم.
Okay. Now, so that concept is okay. So how I look like on both sides? So we have the 6. Okay, we need 6 arteries. Now, the important point is what is aortic arch? Okay, what is the aortic arch? Aortic arch or the aortic sac, some people say aortic sac is also, it is the last part of the truncus arteriosus. So if I draw the same way, like if I want to draw a heart, so this is the heart, for example. In reality, this heart is actually looking like this way, isn't it? This is the heart. This is the transverse sinus. Is that okay? Everybody knows that the folding. So where is the truncus arteriosus? Over here?
Yes.
Everybody understand that? Yes. Okay. So the last part over here we call aortic sac. Okay? The last part. This is also some books are writing aortic arch. Okay? There will be 6 arches will be coming from there. 6 arches coming from there.
This above the
Yeah, this. So the 6 arches means, there will be 6. 1, 2, 3, 4, 5, 6. This side, it will be like this. Very nice diagram. Very simple. I said there will be truncus arteriosus is there on the top. Now we have to make pulmonary artery and the aorta. Final thing, arch of the aorta. How it is formed? That's what I'm going to tell you. So I'm saying that apart from pulmonary artery and the aorta, there are other arteries there. There are carotid artery, right? So how the carotid artery is coming? They are all coming from this arch. This is arch. Okay? And you are right, the carotid artery is going one of the pharyngeal arches over there. So how it is happening, I'm going to tell you that. But for the time being, appreciate this diagram. This diagram is not in your book. This is my imagination, and which will help you. This is the aortic arch, not arch of the aorta. Actually, if you want to clear your mind right now, arch of the aorta is coming from the 4th aortic arch. Write it down.
What?
4, number 4. I'll tell you about the 1, 2, 3, 4, 5, 6. But the number 4 is responsible for the formation of the arch of the aorta. So the 4th aortic arch is forming the arch of the aorta. I'm coming to that later, but I want to make sure that you understand the two terminology, arch of the aorta versus aortic arch. How many aortic arches are there? 6. No. Aortic arch is not pharyngeal. Pharyngeal arch, I showed you already my diagram, how I look like. Pharyngeal arch is this. This is the pharyngeal arch, pharyngeal arch over here, inside also pharyngeal arch. But aortic arch is supplying one artery. Aortic arch is an artery. And this arch has a muscle, has a artery, has a nerve, many bone, many things are over here. If you put it over here, artery, vein, muscles, all this. This is called pharyngeal arch. Is that clear or not clear yet? What I've drawn earlier is the pharyngeal arch. Like pharyngeal arch will be. Maybe I can draw that. Yes, I can make it. Now look at that, how I look like again. And I look again, this I do like this, I do like this. Okay? So here is my eye and the. So what I'm saying is this is arch, pharyngeal arch, which has the vein, which has the artery, which has the nerve, which has the muscle, which has the bone. But I'm talking about the aortic arch is artery. Is artery, one artery. What is the problem now?
Is each artery inside the pharyngeal arch?
Yeah, each artery is going inside the pharyngeal arch. So each one will get one artery.
From the aorta.
From the aortic arch, that's correct. And you'll see that you'll open up when I show the real diagram from your book. But is that a problem to you? Everybody understand? Pharyngeal arch is muscle, bone, artery, nerve. And you can see that, there is a bone. Nice bone. You can do that too. Is there bone there? Yeah. So that is a pharyngeal arch bone. Again, over here, all these things. This is the mandible is there. So these are bone. These are arch. But each one will have one artery coming out from the aortic arch. Very good. And I said, aortic arch is different from arch of the aorta coming from? Wow. Half of the lecture is done. Okay. Now you have to understand. And you can understand how it is working. Like this diagram tells you 1,000 words, isn't it? Yes. It tells you what is going on over here. Very good. Now I have to make it happen. Now look at this, what is happening. When the development is there, like I can put it again, the development means, this is a nice little baby over here, and the heart is present right over here. You can see the heart is over here. Okay? And here is the area, arch and the pouch. You got it? Arch and the pouch over there.
Just a second.